Good afternoon, everybody, and thank you for joining today's briefing on COVID-19 in North Carolina. As of today, we have 41,249 lab-confirmed cases, 1,768 new cases reported today, a new high, 760 people in the hospital, and sadly, 1,092 deaths. Dying from COVID-19 or mourning a loved one who right now can be isolating and difficult. We're really praying for all those who are suffering now. And today our concern is growing about the increase in cases and hospitalizations in North Carolina. This is also happening in many states across the country. While our hospitals still have capacity, we know this can change quickly. So we're working with hospitals and tracking hospitalizations and ICU beds closely. Today is North Carolina's highest day of new cases since the pandemic started, and it's also the highest day of testing that we have had, with over 21,000 tests reported. But the high number of new cases is not just related to more testing. These numbers show the disease is spreading and that more people need hospital care, and this has to be taken seriously. In the last week, we've done an average of over 15,000 tests a day, and this is a high number and it's good, but we know we still need to do more. Testing is available all over the state, but we're specifically targeting historically marginalized communities and other high-risk populations. The state is also working to surge testing to hotspots as those needs emerge. We also know that when you've been in a crowd, your risk of contracting COVID-19 increases. This is particularly true when many are not wearing face coverings and there's a little social distancing. So we recommend that anyone who's been in a crowd get tested, even if you have no symptoms. Today we have an update on our key metrics from Dr. Mandy Cohen, our Secretary of North Carolina's Department of Health and Human Services. And I'll hand it off to her now to make her presentation. Dr. Cohen.
Thank you, Governor. It's day to day for those of you who like graphs. So we are now 3 weeks into phase 2, and as I said earlier in the week, I am concerned about our COVID-19 trends. North Carolina is not alone. Many other states are seeing increases in COVID-19 cases as well, and this virus is still a serious threat. We've seen in other states how a stable situation can quickly become anything but. So as I walk through the data today, you'll see that unfortunately it's been another record-setting day. As a reminder, we look at a combination of trends that guide our decision-making. That includes COVID-like syndromic cases, lab-confirmed cases, positive tests as a percentage of those total tests, and hospitalizations. These subset of metrics are chosen based on public health data and White House guidance. And we can't look at any one of these metrics in isolation. We really need to look at them as a whole package when making decisions. And each one of them has limitations. Let me go through them now. On this first graph, we look at people who come into the emergency department with COVID-like symptoms. This metric serves as an early detection mechanism. And looking at the yellow line, you can see there is a small uptick at the right-hand side of that graph, which represents this past week. As I look to the next graph, these are our laboratory confirmed tests. Again, I draw your attention to the yellow line. You can see there's a fairly sizable increase in new lab confirmed cases. And as you heard from the governor, today we have seen the highest number of positive cases at 1,768 new cases, which you will see that top blue dot on the right-hand side represents that high record number. We've now seen 4 days with cases above 1,000 in just the last week. We are also setting records on the testing side done each day as well. And as a result of this record high amount of testing, we did expect this number to go up, but it's the pace of the increase that is concerning and shows us that this virus is still very much present in our communities across our state. I'm going to zoom in now. This next graph shows the exact same data I just showed on the last slide of lab-confirmed cases, but now, again, zooming in for a slightly closer look. This graph shows data since May 1st and not all the way back to March, so you can see it in a little more detail. So looking at the yellow line, again, it's a 7-day rolling average. This metric is trending up, and you can see it's accelerating as the slope of that yellow line is becoming steeper in the last 2 weeks. Now moving on to the percent of tests that are positive. This metric provides an important context for our number of cases. I want to draw your attention again to the yellow line, and you can see the percent of total tests that are positive have been just slightly increasing, and today is at 10%. But if you look at that 10% in the context of our nation, our percent positive is now one of the highest amongst states in the nation. We'd like that number to be closer to 5%. Our next metric here is about day-over-day hospitalizations. Again, the yellow line shows that North Carolina's trajectory of hospitalizations is rising. Yesterday was our highest day of hospitalizations with 812, but our hospitals still have capacity, as the governor said, to meet the increased demand if more people become seriously ill. But this continued rise in this metric is concerning. Finally, an update on testing. Looking at the yellow line, you can see that daily testing really is trending up, and we continue to make significant progress in expanding our testing. Over the past month, we've tripled our testing from about 5,000 tests on average today to 15,000 average tests per day right now. Yesterday was our largest day of testing with more than 21,000 tests completed in one day. All right, putting that all together, where are we? First, surveillance data shows that slight uptick, gets a yellow line. North Carolina's trajectory of lab-confirmed cases does continue to increase and is accelerating. It gets a yellow X. North Carolina's trajectory of percent of tests returning positive has increased slightly over the last week, and so this gets a yellow line. North Carolina's trajectory of hospitalizations also slightly on the rise, and this trend gets a yellow line. We also track critical capabilities. We look at both our trend metrics, those that I just shared, as well as our capability metrics, meaning our ability to respond to this pandemic. And our ability to respond is where we really see positive trends and a ton of work that has gone on. First, as I've been saying, testing has had an upward arrow as we've been averaging more than 15,000 tests a day. We have more than 450 sites listed on our website, plus additional pop-up testing sites that folks can go to. And our RFQ for additional test sites purchased from the state government just closed, so we will soon be able to surge even more rapid response testing where it's needed in the state. We've hired more than 250 contact tracers to bolster our efforts of our local health departments and are in the process of adding even another 200 to meet the ongoing need of our local health departments. These COVID community team members reflect the diversity of the communities they serve, and more than half are bilingual. More than 1,100 local health department staff and community team members have completed state-led training on contact tracing, and our PPE supplies continue to be stable. We have enough critical supplies on hand to fill requests for at least the next 30 days, so capacity looking good. We have those tools to respond to this crisis and slow the spread of the virus, but we all have to work together on this. We can protect our families and neighbors. We can rebuild our economy. We can look forward to our children returning to school, but we must all do our part to make these things happen. First, we must all practice the 3 W's. Wearing a face covering, wait 6 feet apart, and wash your hands frequently. These easy actions have huge impact, but each person needs to do them for us all to benefit, and do them consistently, every day, every time. So this weekend, if you're leaving your house, make sure to grab that face covering before you go. Wash your hands every chance you get, and make sure to stay 6 feet apart from others. Second, if you think you've been exposed to COVID-19, get tested, even if you don't have symptoms. If you attended a mass gathering or a protest, get tested. If you work in a setting of high-risk exposure, such as a grocery store, a child care program, or a restaurant, get tested. If you work in a high-risk setting like a food processing facility, get tested. Third thing we can all do, answer the call. The local health department staff and other COVID community team members are reaching out to people who may have come into close contact with someone who tests positive for COVID-19. The team will connect them with important information and support to make sure they can get through this time. We continue to do our part to respond to the crisis. We continue to strengthen our testing and contact tracing infrastructure. Because we were aggressive and took early action, we bought ourselves valuable time to build that capability so that we'd be in the best position to be able to responsibly ease restrictions. We can now draw on these capabilities, but if we all do our part, we will not overwhelm them. Early on, North Carolinians came together and proved we can flatten the curve, and we can do it again. Remember, we're all in this together. The actions that we all take right now will help protect our friends, our families, our neighbors, and will save lives. Thank you, Governor.